Good afternoon. Thank you for joining us today for the EVV public meeting. We're going to get things started here. So just some general housekeeping before we get through the presentation. All phone lines are muted. You will not be able to vocalize your questions. Those questions that you do have throughout the presentation, please submit them through the chat feature. And the questions that you do submit, we will try to address as many of those as possible at the conclusion of the presentation. So today's presentation really is to provide some updates on where we are with EVV implementation. We will be going through some of the information that has already been provided and the information that is available on the DHS EVV website. We did want to let everyone know up front that we are reviewing the new CMS guidance that was just released last week. We will provide updates related to that guidance at a future point. We're aiming to provide that information prior to the next public meeting, which is scheduled for September 17th. But again, we are discussing those items internally, and if you have feedback related to them, please send us information and your concerns or what you would like to see from that guidance to the resource account, the EVV resource account inbox. Now, one of the decisions that we have been able to make is that respite camp which is provided by ODP, is no longer included for the January 1st, 2020 EVV implementation. We wanted to make sure that even though we are removing respite camp, all other respite services, which are, again, in unlicensed settings only, are still required, and you'll see the full list of services on the DHS EVV website. It has been updated. So one of the questions that we got a lot from the previous public meeting is the breakdowns of who should be using which systems. So we wanted to walk through the differences between the DHS SAN data system and the CHC HHA exchange system. So just to recap the fee-for-service programs that we're looking at, and again, EVV implementation at this point is only for personal care services. And again, that implementation date is January 1st, 2020. So the fee-for-service programs that we are addressing here are under the Office of Developmental Programs, or ODP, and those waiver programs are Consolidated, Personal Family Directed Support Waiver, and Community Living Waivers, Intellectual Disabilities and Autism-based services, as well as Adult Autism Waiver. And we wanted to note that this is for agency and participant-directed services. Also, under the fee-for-service programs, we have the OLTL programs, or Office of Long-Term Living programs, of the OBRA waiver and the Act 150 program. And again, as we noted previously, respite camp is no longer included as a personal care service that needs to comply with EVV implementation for January 1st, 2020. So for fee-for-service providers, there are two EVV options that will be available. The first option is the DHS SAN data system, and this is the system that we are offering at no cost to providers. There's the mobile application, or SAN Data Mobile Connect, or telephony as the options for capturing the visit information. And then it also includes the web portal that allows the provider to make visit corrections. That's the first option. The second option is for those providers to use an alternate EVV system. And again, the alternate EVV system must integrate with the DHS aggregator, and it must capture the required data items that have been identified in the alternate EVV technical specifications and the DHS addendum. The technical specifications and DHS addendum documents are on the DHS EVV website. So if you are planning to use an alternate EVV system, you should check out those documents. And if you are planning to use an alternate EVV system, we wanted to make sure that you are aware that providers are responsible for any costs related to those alternate EVV systems. So again, if you are using or plan to use an alternate EVV system, you need to go through an approval process with SANdata to ensure that they can capture that EVV data and feed it into the DHS aggregator. So as we've noted here, the SANdata approval process for alternate EVV systems ensures EVV transactions are in the correct format, contain the required data in mandatory fields, and can successfully pass into and be stored in the DHS aggregator. So again, you want to review those technical specifications and the DHS addendum for those specific requirements to ensure that the information can be captured in the DHS aggregator. So we also wanted to note that providers that are using a SANdata approved alternate EVV system will need to complete web-based training as a condition of the approval process. And if you are utilizing an alternate EVV system or plan to, or if you have questions specific to alternate EVV, please contact SANdata. They have the SANdata alternate EVV support team, and their contact information is as follows. It's 1-855-705-2407, or you can email at paaltevv@sandata.com. They are on the screen here. We wanted to recommend that you reach out as soon as possible to SANdata if you are planning to use an alternate EVV system, since the certification process can take up to 60 days. And we are expecting providers to submit EVV data to the aggregator beginning in October 2019. So again, that's only 2 months away from today. So we also wanted to provide you an update on participant-directed services. Under the OLTL program, PPL is using Time for Care, an alternate EVV system, and the training on that system began earlier this month. For ODP programs, this was a question that came up at the previous public meeting. What was the status of PALCO? We don't really have an update at this point, but PALCO is moving forward, we believe, with an alt EVV system, and we will provide updates on that at a future point. So we presented information on fee-for-service providers. So now we're going to go through the CHC providers. So under Community Health Choices program, we have the Community Health Choices 1915C waiver. This is one of the programs where we have the personal care services. And again, that includes agency and participant-directed services. So for CHC providers, you need to work with CHC MCOs to identify the requirements that the MCOs may have for EVV collection. The CHC MCOs are offering HHA exchange free of cost to capture that EVV data. HHA exchange will be sending the EVV data to the DHS aggregator. So CHC providers can use alternate EVV systems, but if you are opting to use an alternate EVV system, you'll need to integrate with the HHA exchange system in order to send that data to the aggregator. And we wanted to note that if you are planning to use an alt EVV system, you'll have to work with each one of the CHC MCOs as appropriate to integrate that system with HHA exchange, because each one of the CHC MCOs has a somewhat different system for HHA exchange. So any questions that you have about HHA exchange in particular should be directed to the CHC MCOs. And we also wanted to make sure that CHC providers are aware that they do not need to receive the DHS SANdata EVV training. We've had a number of individuals reach out to us, and you do not need to take that training. So just to walk through it again, for CHC providers, we have the alternate EVV systems, we have the fiscal employer agent EVV system, or time for care, and we have the HHA exchange EVV system, all pooling that EVV data for CHC providers and going into the HHA exchange aggregator. HHA exchange then will send all the information to the DHS aggregator. We wanted to note that the information really flows only one way, and that is from HHA exchange to the DHS aggregator. Wanted to remind everyone that the PowerPoint can be downloaded from the handout section of the webinar. In case you are unable to follow along today, we will also be posting this to the DHS EVV website along with a recording of today's presentation. So for those providers that have both fee-for-service and CHC, we wanted to call out that there are two options for those providers. You can use an alternate EVV system. If you do use an alternate EVV system, you'll need to work with both HHA exchange, that would be for CHC participants, and then also with DHS same data for fee-for-service programs. And that's to ensure that we're getting all the essential EVV data for your personal care services being provided. The second option is that providers may work directly with HHA exchange or SAN data to discuss options to expand the scope of the existing, what we're considering the free systems, to include both CHC and fee-for-service program needs. We wanted to make sure that you are aware that providers will be responsible for costs associated with any upgrades to the existing free systems. Also wanted to note that if you are moving to CHC as of January 1st, 2020, and all of your participants are in CHC, you do not need to utilize the SAN data system in the interim. So just to show what the DHS aggregator will be doing, it will be collecting all the information from the fee-for-service providers and CHC providers through HHA exchange and pulling all that data into one single location. So just as a reminder, the DHS aggregator does not submit claims. The DHS aggregator is validated against during claims processing when an EVV service is found on the claims transaction. And as we've mentioned in previous meetings, beginning January 1st, 2020, if EVV data does not match the claim will be denied and adjustments will be necessary for resubmission. Also, the DHS aggregator includes a read-only web portal for the provider to view their data and a payer web portal, which includes alerts, real-time data views, and reporting. So we wanted to provide a little bit of a demo of this DHS SAN data EVV system. We had a number of questions regarding how it would look and how it would feel. We do have a live demo video on the DHS EVV website. We will not be doing a live demo of the system. Our system is actually still being built out at this moment, but we wanted to walk you through what it would generally look like based on what we've seen in the past and the commercial off-the-shelf product that SAN data has available. So the general process is that the caregiver arrives in the home or the community. The caregiver then uses the mobile application or telephony to check in. The caregiver then provides the service. Once the service is completed, the caregiver uses the mobile application or telephony to check out. If the corrections are needed, the provider agency makes any corrections in the web portal to that data, and then the data is submitted. And that data goes into the DHS aggregator. So throughout this process, Those 6 required items are captured. The date of service, the service being provided, the clock in and clock out times, the caregiver, the participant, and the location. So all that information is captured during this process and submitted. So Sandata Mobile Connect is the mobile application that is offered through the DHS Sandata system. Again, this is free, being provided for free and for the fee-for-service providers. So using the Sandata Mobile Connect, the caregiver would download the app onto their phone and then access the application. The screen on the left is what the caregiver would see. They would need to enter all the necessary information, including the company ID, the username, and the password. And again, the username is the actual email for the individual. And then on the right, you'll see where the caregiver actually searches for the client using a client identifier. The caregiver can also start a visit from a schedule if one has been created in the provider portal. So on the next screen, you'll see on the left-hand side is a list of services, and this is a drop-down. So the caregiver can select the services. I wanted to point out that these are not the services for Pennsylvania. This is just an example. So just in case you were concerned, those are not Pennsylvania services. Ours will look a little different. On the right-hand side then is, the caregiver reviews the service, the clock-in time, and then can select starting the visit. So they would select yes. And that clocks them in. And then the caregiver delivers the service. Once the service is completed, the caregiver then once again goes into the application and continues the visit in order to process the visit and close it out. So as you'll see on the left picture, the caregiver would want to complete the visit, select that, and then on the right-hand side, you'll see that it shows the visit summary with the clock in and clock out times, and the caregiver would select confirm to complete the visit. You'll also note on the picture on the left-hand side, it does allow for the capture of the visit notes. It says, are there any additional details you would like to provide? And that's where tasks and additional notes could be captured. So also within Sandata Mobile Connect, we have the availability of 13 additional languages. And you'll see that on the left-hand side, there is a drop-down list of the languages that can be selected. And on the right, it just shows an example of the screens in Spanish. So then the other option for the caregiver to use is telephony visit verification. And for the DHS Sandata version, the caregiver calls at the beginning and the end of each individual visit. The caregiver uses the participant's home telephone or can use a cell phone for the EVV process. And toll-free numbers will be provided and made available 24/7. So just to walk through it really quickly, the telephony visit verification process is upon arriving, the caregiver would call the toll-free phone number. There will be a prompt that says, welcome, please enter your ID. The caregiver would enter their EVV ID. Then there will be the prompt that says, press 1 to clock in or press 2 to clock out. The caregiver would press 1. The prompt would then say received at the time that the call was generated, and then the caregiver would hang up. The same process would be repeated for the checking out of the service. So then the other part of the DHS Sandata EVV system is the web portal. And the web portal provides near real-time capture of data. and allows for near real-time monitoring. The exception flags for visits that are missing required data show up within the system, and the administrators can resolve those visit issues or errors nearly immediately. Additionally, the data supports claims submission, and the web portal offers standard summary and detailed reporting. So just wanted to walk you through some of the screens that you would see within the web portal. Using the web portal, providers are able to review EVV activity in this portal. As you can see from the image that is here on the right-hand side of the screen, where you see the red dots is where the exceptions have been generated or flagged, and that's the required data that is missing. The provider would then click on a visit to open the details to review and make the necessary corrections. So clicking into the call log, you can see all of the details of the visit within that screen. So then the provider user can review exceptions and make corrections to the visit. You'll see all the exceptions noted here. Like the first one is the visits without out calls. So the exception will need to be fixed. There's also the note of missing a service. Clearly, that exception needs to be fixed. And additionally, visit corrections will require a reason code and will be logged in the History tab. That was just to show you a little bit of what the web portal would look like for the DHS SAN-Data system. So just a reminder that there are two important dates for us to remember. October 2019 is when the soft launch of the DHS EVV system begins. DHS is expecting providers to use EVV and send EVV data to the DHS aggregator as of that date. Again, CHC providers in the third phase of implementation will be expected to be up and running by January 1st. So it is a little bit of a difference there, but we are expecting all other providers to meet that date. DHS will be using the time between October and January to determine what we consider pain points for providers and make any adjustments to our system on our end and provide technical assistance to providers as well. During that time, there will be no denials of claims based on EVV data not being contained in the system, but we are expecting providers to be prepared and begin using EVV in October 2019. So then as of January 1st, 2020, that's when full implementation of the system will be required by the Cures Act, and DHS will begin to deny personal care service claims that do not have EVV data in the DHS aggregator. So exceptions. We wanted to address exceptions that would be generated. For the initial phase of EVV implementation, exceptions are generated by the DHS EVV system when one of the 6 required items is missing. And again, those 6 items are the date of service, the location of the service that's provided, the individual providing the service, the individual receiving the service, and the time the service begins and ends. We also wanted to call out once again that for providers using alternate EVV systems, the technical specifications and the DHS addendum on the DHS EVV website detail the information that must be captured and submitted to the DHS aggregator. So we had a number of questions related to services and what actually falls under personal care services. We wanted to make sure that you understand that the full list of services, as well as the service codes and modifiers, may be found on the DHS EVV website. An updated list will be posted that includes the removal of respite camp as soon as possible. That's for the service code and modifier list. We also wanted to make sure that providers understand that the DHS SANDATA EVV system will only support the OLTL and ODP services outlined on the DHS EVV website. Also, caregivers must check in and check out for each individual service provided to a participant. So each time that a new service is delivered, the caregiver must check in and check out. Additionally, service provision should support and align with the service definition found in the approved waivers and the service's duration, frequency, and scope as described in the individual's approved plan. So we had a number of questions related to location, particularly for travel and or vacation. And we wanted to make sure that providers understand that EVV requirements do not change current program requirements. So if these are currently allowed, then they will continue to be allowed. Also, providers will be able to enter multiple addresses where services are provided into the DHS SANDATA EVV system, and these addresses can be updated at the provider level as needed. So the SANDATA mobile application does require GPS to be enabled at check-in and check-out to capture the location. However, GPS can be disabled and re-enabled on the user's phone in between check-in and check-out. Because again, the location is only required to be captured at check-in and check-out. We also wanted to let you know that GPS does not require cellular and Wi-Fi connection. And the mobile application works in offline and will upload the information to the system and submit once connectivity returns. Finally, related to location, the place of service is a required field on a claim, and only one code is permitted on each claim detail line to specify where the service was rendered. This is just a continuation of normal business practice, but we wanted to include it here since we did have a number of questions related to that. So related to time, we wanted to make sure that providers understand that billing should align with check-in and check-out rules as defined by the provider agencies. If one caregiver clocks in at one time while another does, or there are overlapping times, this will generate an exception and will need to be fixed through the web portal by the administrator. Also, shift corrections such as a missed clock in or clock out may be addressed in the provider portal, which we did show earlier. And units of time for billing of services will continue to follow existing rules and practices. So OLTL does allow for rounding of units of time, and ODP does not. But ODP will issue a guidance document this month that will help to clarify some of these units of service. That will be made available on the DHS EVV website as well. All right, related to the individual providing the service or a caregiver, more than one caregiver can use the same smart device to access the DHS SANDATA mobile application. Because the user identifier is the email for the individual, that is the access point. So any smart device can be used by numerous individuals. A participant's home phone, cell phone, or smart device may be used for check-in, check-out, but only if the participant has agreed to its use. And we just wanted to once again reinforce that DHS is using a bring your own device model and will not be providing phones or smart devices such as tablets for visit capture. We also will not be providing reimbursement for data plans. For those services where 2-to-1 staff to participant ratio both caregivers must check in and check out for the same individual, same service, same date, same time, and same location. And I know that we addressed this at the last public meeting, but we wanted to make sure that we address this again, that tasks may be entered in the notes section of the SANDATA mobile application, but we are not requiring tasks be captured at this point. So for the individual receiving service or the participant, we wanted to make sure that you're aware that visits that include more than one participant receiving the service at the same time, or group visits, these may be captured in the DHS SANDATA EVV system. Group visit setup will be covered in the DHS EVV training. And signatures from participants are only required in those instances that currently require them, such as participant-directed services. And although caregivers may use a participant's cell phone or smart device, participants are not required to allow caregivers to use that home phone, cell phone, or smart device. And provider agencies should generate policies regarding caregiver requests to use participant personal devices. So with that, we wanted to let you know about the DHS SANDATA EVV training. This training is mandatory for fee-for-service providers. That is both the users of the DHS SANDATA system as well as alt EVV users. Now the alt EVV users will have a different training that is part of the certification process. But for those that are intending to use the DHS SANDATA system, we will be offering the classroom, webinar, and self-paced options for training, and that should begin September 24th, 2019. The registration should open August 26th, 2019. We should have a communication sent out through all of the listservs. I believe it will go out August 23rd. And wanted to note that the classroom and webinar trainings, only 2 individuals per provider agency may attend those trainings. And those staff then will train the staff of the provider agency. And we are recommending that those 2 individuals that attend the training from the provider agency be administrators. Also wanted to note that the classroom sessions will be held in several different regions throughout the state and over several different days. But again, we'll be sending out a communication once registration is open, and that will also include all the directions on how to register and where you'll need to go, or how to access the webinars. And just wanted to make sure that everyone is aware that the training is going to be offered with phased-in system use, and that training will continue to be offered through full implementation, so through January 1st, 2020. And once again, the locations, dates, times, and registration instructions for the trainings will be posted on the DHS EVV website, in addition to being sent out through email, through those listservs. Additional upcoming communications, will be sharing a provider checklist communication in the next few weeks, in addition to that training registration announcement. And again, they'll be sent through the listservs this month. We'll also be sending out a survey as part of those communications that will be asking providers to complete to help us determine who's planning to use an alternate EVV system or the DHS SANDATA EVV system. We'll also be updating the frequently asked questions document that is currently posted on the DHS EVV website, and that will be updated and reposted to the website later this month. far as the public webinars, we will have one in September, as well as October, November, and December. The dates are here. Of course, they are subject to change, but we are planning at least for September 17th for that updated webinar. So at this point, we will turn it over to review some of the questions that have been submitted through the chat feature, and we're just going to compile them internally here, and we'll be right back with you. Okay, the first question that we received is, how will telephony capture the location of service? And the location of service will be collected based on the address that's registered for the home or that landline. The second question that we received is, if you're using HHA Exchange EVV, does the provider need to go through the approval process? No, they do not need to go through the SANDATA approval process. They'll need to work with the CHC MCO. We had a question that came in that said, how do I know if I'm a fee-for-service provider? We would recommend that you contact provider enrollment to determine if you are a fee-for-service provider. So we had a question, will claims need to be sent service per day, or can they continue to be billed to promise as a summary bill? And we just want to let you know that billing will not change. so continue current practices.
Is that okay?
All right, we had a question. What specific aggregator data is a claim being validated against?
Okay, so the units that are found on the claim transaction that is submitted, that will be validated against what is found in the aggregator. A second item would be the data service that's found on the claim transaction. That will be validated against the data service that's found in the aggregator, as well as what we call the recipient ID number, which is really an MCI number, master client identifier, with a check digit at the end. That'll be validated against the procedure code, and if there's a modifier with that, or modifiers with that procedure code, that, again, that'll be validated against what is found in the aggregator. And the 9-digit MPI, some people know it as a legal entity number. So those are the different data elements that will be validated against the EVV aggregator.
Okay, our next question is, will EVV submissions to the aggregator be consolidated when compared to the corresponding claim submitted to Promise? We can provide multiple services on the same day, and they're currently consolidated into one claim so as to not receive an ESC 5001 duplicate invoice. And our answer to that is that current billing practices will not change just because we're implementing EVV.
Okay, we have a question that says the following: does the agency determine when the data is submitted? The agency may not check EVV data until the next morning, so wouldn't want data submission to be automatic. Okay, so the bottom line is, when you bill, there must be, if it's an EVV service, when you bill, the transaction must be found in the aggregator, or you will not pass claims validation. So, you know, submit the aggregator transaction if you're using alt EVV, or whether or not you're using DHS. how often they appear or are sent to the aggregator, you just got to be mindful that you do not bill until you know that the EVV transactions are in the aggregator, like passed into it and are stored there. That's kind of the bottom line. If you want to bill once a week, send the transactions to the aggregator once a week, that's up to you, but just a word of caution that, if you bill and those transactions are not in that aggregator, then you will fail the validation call that's made.
Okay, our next question is, what is HHA Exchange EVV? Is that an alternate system? And the answer to that is that HHA Exchange is the authorization system that the managed care organizations are using under the Community Health Choices program. Our next question is, we've not heard from anyone yet to set up our EVV. And our answer to that is that you will need to contact Sandata with your information and work with them to set up your electronic visit verification system.
We had a question come in asking if we have a list of the successfully approved third-party vendors, and we do not have a list, and we will not be supplying a list. We are not endorsing any specific, alternate EVV systems, so it is up to the providers to determine which system they wish to use.
Hi, we have a question. It is it mandatory to use Sandata? We are currently using HHA EVV, and we are unable to do many of the things you talked about in this training. Is this an acceptable system to use? It is not mandatory to use Sandata, and that is just the system that DHS is offering as an EVV solution to folks who are subject to EVV, who render PCS services and are subject to EVV. Or you do have the option to use an alternate EVV vendor, and HHA would be one of those vendors that you can use. The functionality, as long as the system, the EVV system can support collecting those 6 data elements that were discussed earlier, then the functionality may or may not be a little bit different than what we're offering through the SANDATA DHS system, but
I'd also say if you are having problems using HHA Exchange, then you should contact the managed care organization to resolve that.
We had a question regarding the procedure codes list. The individual couldn't find it on the website. Currently, the list of codes and modifiers is included in the alternate EVV DHS addendum document, pages 9 through 12. They will be posted to the front page of the website once we have them updated to remove respite camp from that list. So that should be up either later today or first thing tomorrow.
Hello, we have a question. It was stated that caregivers must log in and out for each service provided. Does this mean that the caregiver must be logging in and out several times during a visit aside from the initial log in, log out? The answer is yes. The caregiver must log in and out as the service changes throughout that visit.
Okay, we had a question come in about PPL system. It has been mentioned that PPL's telephony is an option that would be available, but I work with consumers who are having difficulty getting the information. I'd say in that case, I would contact PPL to find out more information about their Time for Care app, but they are currently doing WebEx trainings for direct care workers as well as CLEs throughout the month of August to train everyone on getting familiar with the electronic visit verification.
Okay, question here is, with the 60-day alternate EVV approval deadline looming and the ODP EVV system not available to review, how are providers to make an informed, unrushed decision? Well, these are two different topics. If you're an agency provider, you should be working with SANDATA or trying to get your alt EVV system up and running, and you should be contacting, be looking at our website and making that contact. Now, if you're an individual or participant who uses participant-directed services and PALCO, well, that training will be separate from, and that information will be directed directly to the CLEs and participants. We expect to be training the CLEs and the participants on the Falco system, and more information should be coming very shortly.
Okay, we had a question as to who providers need to contact or call to get set up to use the DHS system or to use the DHS EVV training. As noted previously, a registration communication will be sent out and providers will need to register for that training. We are not doing anything additional for providers to let us know what system they are using prior to that. So that is how you'll notify us, is by registering through the registration system for the training. And again, that communication should be sent out later this month. We'll also be posting that information to the website. Had another question, is there an EVV listserv, or what listserv will providers subscribe to for EVV information? Yes, there is an EVV listserv. I just scrolled to the last page here, which includes the resource account email address. If you are interested in being added to the EVV listserv, please send an email to that resource account email address, and we will have you added to that listserv. We had a question asking if we would be open to extending the soft launch period. And at this point, we are not looking to extend the soft launch period beyond January 1st. However, we are continuing to monitor, and there is the availability of the good faith extension. We would need to apply for that no later than the end of November. So once we see how things are going with our implementation, as of October, we will continue to review this, and we will provide any updates as we continue to review.
We received a question, what does it mean to clock in for an individual service? This means that you use either the SANDATA DHS system of EVV to clock in and clock out, telephony, which is available through SANDATA, or the alternate EVV system to clock in and clock out, meaning inputting the data elements required. We also have a question about if I am an in-home community provider switching from HAB to Companion, does the provider need to clock out of HAB and clock into Companion? Yes, as the direct care worker provides Companion services and then switches to HAB services, yes, you must clock in and clock out using the appropriate EVV system.
Okay, our next question is, just confirming, skilled home health services, even those reimbursed by the CHC MCOs, are not responsible for submitting EVV on January 1st, 2020? And the answer is that is correct. Our next question is, how are adult day services going to do this? And the answer is that EVV is not applicable to adult day services. Okay, another question that we have received is the transition from the Office of Long-Term Living to Community Health Choices will be a challenge. Does it make sense to get that transition done before implementing EVV? Doing both is a challenge to our agency and clients. And our answer is that yes, we can sympathize that that is going to be a challenge, but EVV is federally mandated to be implemented by January 1st, 2020. And at this time, OLTL does not have any plans to delay the launch of Phase 3 of Community Health Choices.
This next question, we kind of already talked about earlier. I believe we did earlier in the presentation, but I'll repeat it. Where can our alternate EVV system provider find the requirements to send over to SANDATA? So the DHS EVV web page contains that information. So it has the addendum and it also has the specifications out there, and that is what the alternate EVV vendor will need to create their transaction set.
for those that are asking again about the credentialing process, you need to contact SanData directly about that. And that phone number is included in the presentation and is also up on the website, as well as the email address to reach out to SanData about alternate EVV systems.
Adult day services are not subject to EVV, and nor are supported employment services.
So we've had a number of questions coming in regarding HHA Exchange EVV. If the provider is already using HHA Exchange, will they still need to use the SANDATA system? And no, you will not need to use the SANDATA system, not unless you have fee-for-service participants that are not captured by the HHA Exchange system. So that is the only instance in which you would need to use the SANDATA system. And even in that case, you could use the HHA Exchange system for those fee-for-service participants. You would just have to work with HHA Exchange on that. So hopefully that is clearer.
We received a question, will providers be able to access the data in the EVV system in order to validate claims prior to submitting to the state? Yes, a provider can review data submitted to the aggregator. They cannot make changes to it, but they can review it prior to submitting the claim.
We received a question that says, can any scheduling be done through SANDATA or only clock-ins and outs? Okay, so the DHS SANDATA solution that the state is offering free of charge, there is scheduling available. That functionality is available, and it's optional whether or not you want to use it. The same holds true for billing. It has billing functionality built into it, and again, optional to use if you're using the SANDATA DHS system, and or you could just use it to clock in and clock out. That is at the option of the provider agency.
We're still compiling questions, so we will be addressing additional questions. Just give us a little bit of time here, folks.
We received a question concerning a location. If an individual and the caregiver plan to go to an outdoor activity, but there's a change due to the weather, the clock in and clock out is the key piece, and the code for location would not change. The specifics of the location, meaning what specific park, that detail is not major. The fact of the log in and log out is what's captured, and the code for the outdoor activity.
Okay, we've had another question come in, and the question is, are claims submitted through EVV? And the answer to that is no, claims are not submitted through EVV.
Okay, there's a couple questions here I could answer probably in a row. If we provide nursing services that are reimbursed from the Office of Intellectual Disabilities, I'm assuming you mean ODP, not aid-based personal care, but rather around-the-clock nursing services, are those nursing shifts also going to require submission of EVV? The answer is no. Discrete nursing is not subject to EVV. Another question is the provider MAID the same as the provider MPI? And the answer is yes. Medical assistance identification number is the MPI. And here's another one. Sorry if I missed this, but if an agency is providing a 1 to 2 service, such as HAB 7059, W7059, will both participants sign the EVV to verify services? Well, in that case, with a 1 to 2, you would be checking, the care worker would be checking in and out for each individual that they're serving. I know it's a 1 to 2, but you would check in and out for the first individual and check in and out for the second individual. And yes, they would both have to verify services at the point of checkout. And another question is nine-digit MPI. Okay, so a master provider index, that's really what MPI stands for. The first 9 digits of an MPI, or we call that the legal entity number, and then there's 4 digits, which actually represents the service location code. So when I say, because the question is 9-digit MPI with a question mark, yeah, so the first 9 digits, which does not include the service location code, that is what is validated against in the aggregator. So whatever is on the claim will be validated against the aggregator at the 9-digit level.
So the question that we received is, how are corrections made to the data submitted? The corrections can be made through either the alternate EVV system that you're using, or if you're using the same data system, you would do those corrections through the web portal. We had another question regarding, if the information is being sent to the DHS aggregator website and that information would be read-only, corrections would be made elsewhere, correct? And yes, you are correct. Those corrections that are coming in from a third-party system will need to be corrected within that third-party system. They will not be able to be corrected within the DHS aggregator.
We have a question. In HHX, we are unable to change and or add addresses. So how does our aid take a consumer on vacation and still stay in compliance with checking in and checking out? You must contact the MCO directly for that change.
So we're getting a lot of repeat questions, and we feel as though we have answered a lot of them. We'll make sure that we post the frequently asked questions document, the updated version this week, if possible. That will include a lot of the answers that have been provided today. We'll also be posting a copy of this PowerPoint as well as the video recording of today's presentation to the website. So I would advise that you go out to the website to check things out. Also, if you have additional questions that you feel you would like an answer to, please submit those to the resource account. It is up on your screen right now, RA-PWEVV notice at pa.gov. If you would prefer to call in and ask a question, you can call the main line for DHS at 717-787-2600 and ask for the appropriate individual that you're asking a question about EVV, and they'll direct you to the correct person to address your question. So again, if you have additional questions, please send them to the resource account or give us a call at 717-787-2600 and let them know that you're calling about EVV. Again, thank you so much for participating today, and we'll look forward to your participation in a future event. Thank you.